Hello and welcome to the 2019 Open Enrollment HR presentation. My name is Melanie Denning. Let's get started. Just a quick reminder that all benefit-related forms, questions, and inquiries should go directly to Healthcare and Benefits. Our dedicated customer service team can assist you and your employees with all benefit-related issues. If there's a scenario where you need to get information about an employee, we will request it from your agency. Remember, the State of Montana Benefit Plan, or the state plan, is self-funded. The state plan is funded by monthly employer, employee, legislator, and retiree contributions. The contributions are held by the state plan and used to pay state plan expenses, the vast majority of which are claims. In 2016, transparent pricing, also known as reference-based pricing, was implemented and allowed us to control the cost of health quality, predictability, and fairness. We call this way of reimbursing providers transparent pricing, but it really was the introduction of what many in healthcare industry call value-based care. In 2017, we saw medical trend, or expenses, decrease, coming in at $130 million compared to $137 million in 2016. In 2017, Navitus became the state's pharmacy benefit manager. Navitus allows for a full pass-through, transparent pricing model that ensures the state of Montana receiving all rebates and reimburses pharmacies the exact amount paid by the state plan. In 2017, we saw prescription trend, or expense, decrease, coming in at $25 million compared to $32 million in 2016. Dental-related expenses remained stable at $8 million. When you then balance our income with our expenses, you get the state plan reserve. State plan reserves are needed because we can't control all of the variables surrounding operating a state plan. We are able to control many of our plan costs, but there are some things that we don't have direct control over, including our largest income source, the employer contribution. The employer contribution is set by the legislature every 2 years. HCBD provides funding recommendations, but ultimately has to comply with the funding set by the legislature. The employer contribution has not changed in 2 years and will not change in 2019. Federal mandates also directly impact state plan expenses. For example, last year, the state plan was required to cover statins, or cholesterol-lowering medications, at a $0 copay due to the Affordable Health Care Act, or ACA. Healthcare and Benefit Division works hard to estimate and evaluate expenses so that we have a general idea of the volume of claims in a given year. But there can be surprises. Medical trend, the increasing cost of medical care, is a huge variable that the state plan has little control over, and it can be very difficult to predict. The cost of medical procedures and prescription medications continues to rise year after year. For example, year to date, the state plan has seen a dramatic increase in the number of large claims as well as the dollar amount associated with large claims. This year alone, we have one claim over $2 million and 3 others that are over $1 million. The state plan needs to always have enough money in reserves to cover all 30,000 plus members when they need us. As noted in the previous slide, HCBD is progressive and works hard to develop and implement cost-saving strategies to keep employer, employee, legislator, and retiree contributions stable. These combinations of all the cost-saving actions, transparent pricing, Navitus PBM, the new Medication Therapy Management Program, or MTM, increased efficiencies at the Montana Health Centers, have all allowed Healthcare and Benefits Division to minimize the financial impacts to all state plan members over the last few years. And while progress is being made and money is being saved, now that we are more than 2 years into transparent pricing agreements with hospitals, HCBD believes that there is an opportunity to do even more to control costs. And we will be asking our hospital partners to look even more closely at pricing. And we ask that state plan members look at any care that they might have outside of the state, and if appropriate, consider keeping it within our state partners. HCBD will continue its efforts to control costs and manage the state plan, continuing to work with Montana hospitals and other partners to address the rising cost of health care on behalf of all state plan members and the state of Montana taxpayers. Employer and employee contributions will remain the same for 2019. HCBD is pleased to be able to make this announcement and would like to highlight that this is the third year that the state has been able to pass through a $0 increase to the state of Montana and its employees. In 2017, HCBD began presenting rate information in a way that showed employees their actual out-of-pocket contribution in an easy-to-understand format, and it has been well received, so therefore we will continue this format for 2019. This information has been included in the open enrollment booklet that will be mailed to all state of Montana employees the week of October 15th. The state 2019 state plan rates have been updated on the HCBD website at www.benefits.mt.gov. In addition to no rate increases for employer or employee contributions, there will also be no change in the medical plan out-of-pocket costs. That means that medical plan copays, deductibles, and maximum out-of-pocket costs will stay the same for 2019. You can refer to the open enrollment booklet, the HCBD website, or the WRAP plan document for additional state plan coverage information. HCBD is completing an RFP, or request for proposal, for the Flexible Spending Account Program, which may result in a new FSA vendor effective January 1st, 2019. More information about the FSA vendor will be provided as soon as the RFP is complete. However, the medical plan FSA limit for 2019 will be $2,650 per year, which is a $50 increase over 2018. And just as a reminder, employees must re-elect coverage during open enrollment for both flexible spending accounts in order to participate in flexible spending for 2019. The majority of issues we have with employees once a new plan year starts is due to the employee failing to re-elect FSA and the Vision Hardware plan. So any reminders you can provide employees regarding this important detail will save many headaches later. Premiums for employees who elect employee optional life insurance are currently withheld on a pre-tax basis. By withholding these premiums on a pre-tax basis, it requires the state to impute income when an employee elects more than $36,000 in life insurance coverage. This results in the employee paying additional FICA, state, and federal tax, as well as state of Montana paying additional FICA. HCBD has researched the impact of imputing income on the optional life insurance coverage and found that 93% of employees are taxed at an imputed income level that is higher than the actual premiums associated with the coverage. Therefore, effective January 1st, 2019, employee optional life premiums will be withheld on a post-tax basis, which will eliminate the need to impute income for this coverage. Please remember, state plan members cannot use the state plan, including the Montana Health Center, for any work-related injury or illness. If you or anyone covered on a state plan, including dependents, gets hurt or sick while working, the state plan will not provide coverage, even if you have a work comp waiver. HCBD has seen an increase in appeals regarding work-related injuries due to no state plan coverage. Please make sure you have the proper insurance coverage in place to cover work-related injuries. Due to larger than anticipated claims, volume, and cost, the state plan must increase retiree rates this year. The increase for 2019 state plan retiree rates in most cases is less than double digits and is lower than market's current medical trend. Non-Medicare retirees will see an approximate 9% change depending on who they cover. Medicare retirees will see approximately 2% change depending on who they cover. Retiree rates have been included in the Retiree Open Enrollment booklet and have been posted to the HCBD website. When employees retire, they may have the option to remain on the state plan, but they may have other options that may be more financially beneficial for them than staying on the state plan. This includes the health insurance marketplace at www.healthcare.gov if they are under age 65, and Medicare supplements or Advantage plans if they are over age 65. For more information on those, employees can contact a state health insurance program or SHIP representative in their area by calling 800-551-3191 or contacting the Agency on Aging, which is the Rocky Mountain Development Council, and anyone statewide can do this at 406-457-7368. Also, if an employee is considering retiring soon, and they will be over the age of 65, they must have Medicare Parts A and B, and they will be automatically enrolled in the state plan Part D for prescription drug coverage. Retirees cannot sign up for any other Part D coverage because if they do, they will not be allowed to stay on any state plan benefits. This year's Live Life Well incentive deadline is October 31st, 2018. Don't miss out. Hopefully, your employees have already had a state-sponsored health screening. We have sent out many reminders. Employees must complete all 3 requirements to earn any incentive. We have added extra screening opportunities at the Montana Health Center locations for October, but we cannot guarantee employees that they can get in if they have waited. Also, be aware that new employees hired after October 15th, 2018 will not be eligible for the 2019 Live Life Well incentive. Health screenings will automatically be reported on My Active Health site. It takes about 1 month from the date of the screening to show up on the site. To earn the incentive, employees must also self-report their nicotine status and their next step activity in the My Active Health site. Even if they did a wellness challenge like the Governor's Stay Active Challenge, for example, they still need to report it on the My Active Health site to earn the incentive. If an employee is not nicotine-free, but they did complete an alternative like a nicotine cessation program, they will have to self-report that as well. Members should self-report their nicotine status and next step activity as soon as they have it completed. They do not need to wait for their health screening activity to show on the site. Please remember that all instructions are available at the benefits.mt.gov website. If an employee is ready to self-report, please direct them to the myactivehealth.com/SOM website. If they go straight to the My Active Health site without reading the instructions on the benefits.mt.gov/incentive page, they may be confused. If there is a medical reason that an employee can't do any parts of the Live Life Well incentive, there are exceptions and alternatives available. Please have them call the Healthcare and Benefits Division to learn more. The 2019 Live Life Well incentive program will be exactly the same. More information will be distributed with the open enrollment booklets, via email, and during the open enrollment presentations. The Live Life Well program restarts November 1st, 2018. This year's open enrollment period runs from October 28th to November 10th. All plan members, including employees, retirees, and legislators, have from October 28th to November 10th to log on to the open enrollment site and make benefit elections for the 2019 plan year. This year, employees, legislators, and retirees will complete open enrollment elections online. There are alternative enrollment options available for legislators and retirees only. Please have them contact HCBD for alternatives. During the open enrollment period, employees can make changes to coverage like enrolling in or waiving the state plan. They can change life and long-term disability elections. They can also add or delete dependents from the plan. However, if an employee wants the Vision hardware plan and plans to enroll or re-enroll in medical or dependent care flexible spending accounts, that employee must complete open enrollment. If employees do not complete their open enrollment election, they will have the same medical, dental, life insurance, and long-term disability coverage they currently have in 2018 for the entire 2019 plan year, unless that member qualifies for a special enrollment period. If employees do nothing, the enrollment in medical or dependent care flexible spending accounts in the Vision hardware plan will terminate January 1st, 2019. If employees have more than $120 of medical flexible spending account contributions available on their account at year end, these contributions will roll over from 2018 to 2019 and will be available for the 2019 medical expense. Remember, employees must re-elect flexible spending accounts and the Vision hardware plan every year. The open enrollment period is also a time that employees can elect to be joint core. If they and their spouse or domestic partner both work for the state and are both eligible for benefits and have a dependent child or children covered on the state plan, they should be joint core. Being joint core means they have one shared family maximum out-of-pocket, and the rate is better than being employee and children and employee only. For more information on this, have them contact the Healthcare and Benefits Division. Employees will receive numerous communications from HCBD regarding open enrollment. There will be postcards, posters that will be available for agencies to hang and mail. There will also be open enrollment booklets mailed in mid-October, numerous reminder emails, and employees will have the option to participate in one of 3 employee webcasts. A recorded version of the webcast will be available after October 18th to access at any time on the HCBD website. A website banner will be added to the Mind site, and pop-up reminders will happen during the open enrollment period. Open enrollment booklets will be mailed the week of October 15th and will be posted online. All information necessary for open enrollment is housed at www.benefits.mt.gov/open enrollment. Employee webcasts will take place Tuesday, October 16th at 10:30 a.m., Wednesday, October 17th at 1:30 p.m., and Thursday, October 18th at 9 a.m. If employees cannot attend one of these scheduled online webcasts, there will be a link on the open enrollment website, www.benefits.mt.gov/open enrollment, to a recorded webcast that may be viewed at any time. The webcasts are being presented using Skype, and if employees have any issues connecting, they should contact their agency IT department. Employees are not required to pre-register for any of the webcasts. Closed captioning will only be available on the recorded webcast that is available after October 18th. For retirees, a postcard has been sent which details the locations and times of the live presentations and access to the recorded presentation. Live sessions will be held across the state beginning October 2nd. Locations include Anaconda, Billings, Bozeman, Butte, Great Falls, Kalispell, Miles City, and Missoula. There will also be 2 sessions in Helena. After October 2nd, a retiree may view the recorded presentation on the HCBD website as an alternative to a live presentation. Open enrollment booklets will be mailed to the retirees the week of October 15th. Retirees who wish to make changes to their state plan benefits must complete their open enrollment elections by November 10th and can do so online this year. Retirees will not receive paper election forms and will be directed to complete their open enrollment elections online. Retirees will have the ability to request a paper enrollment form by contacting HCBD. During and after open enrollment, other important documents will be coming from HCBD, including 2019 WRAP Plan Document, or WPD, which outlines everything that's covered and plan details. Members will also receive a summary of benefit coverage. This is a legal document required by the Affordable Health Care Act, and it is a short summary of our plan. State plan members will also receive Medicare Part D creditable coverage letters and a few other legal notices. Big changes are coming. Healthcare and Benefits is implementing a new benefits enrollment and administration system, Business Solver, which will replace the enrollment functions currently used in Sabres. The Business Solver system will be used for the 2019 open enrollment by employees who may either use the single sign-on capability on the state network or utilize a login and password function at home, as well as legislators and retirees. With the new Business Solver system, state plan members will also have the ability to complete open enrollment elections on their mobile devices. State plan members will access the new system by clicking the Open Enrollment white Montana logo on the HCBD website. The logo and the link will appear on the HCBD website when the open enrollment system is ready to go live October 28th. Login instructions will also be provided in the open enrollment booklets during the webcasts, on the HCBD website, and using reminder emails. The HCBD website will also be getting a facelift, so watch for more information on these 2 exciting changes. For employees, although the look and feel of the application has changed, the process of completing the various enrollment sections is still very similar. When a member first accesses the new system, they will be asked to consent to electronic signatures. Once logged into the new system, this is the home page, and the members will start here to begin their open enrollment elections. Once a member logs in, the open enrollment process that they will be prompted to review the personal information on file. Sabres is a system of record for employee personal information, so any information that is incorrect on this screen must be updated in Sabres. This page contains a notice to employees that the information must be updated in the MINE and will include the MINE website URL. Business Solver will be updated the following day with any personal information changes. Prior to open enrollment starting, we encourage employees to verify their personal information in Sabres and update as necessary. The postcards regarding open enrollment presentations direct employees to verify their information is correct in the MINE site. The next section is for dependent information and allows members to make dependent information changes and to add or delete dependents. If a dependent is not listed on the employee dependent page, the member will be able to enroll that dependent on state plan coverage on the enrollment tabs that follow. When they click through each benefit section, electing or waiving coverage and selecting dependents to be enrolled, similar to how they've done this in the past. And this is a screenshot of the medical section. Once all elections have been made, the member will be prompted to confirm their elections and agree to bi-weekly payroll withholdings. If any additional action steps are required based on the elections the member has made, such as dependent verification or evidence of insurability, they will then be prompted to complete the action required. If they are unable to complete the action at the time, they can click Next, and the system will remind them at a later date via email that they have an outstanding action required in order to complete their enrollment elections. Once complete, the members will be taken to a confirmation page and they can print a copy of their elections by clicking the Print Benefit Summary button at the top left corner of the screen. The Message Center will house a copy of their confirmation notice, and the Message Center will also be used to provide members with other important state plan communications, such as reminders about dependent verification or evidence of insurability. Beginning January 1st, 2019, the Business Solver system will be fully implemented and all enrollments will be completed via the new system. This will include all events such as new hire enrollments, mid-year changes, beneficiary updates, etc. The enrollment system will be available for employees, legislators, and retirees for all enrollment types. Additionally, HCBD is excited to announce that the system has functionality for enhanced communication, increased automation and reduced manual audits, automated billing, and enhanced system functionality to match market demands. As always, the most important thing you can do is to ensure the accuracy of an employee's access to benefits is to keep Sabres updated with accurate employment information, including terminations, deaths, leaves of absences, FMLA, etc. If you have questions on how to update Sabres, you should contact the State Human Resources Division. If you have questions about the new system, feel free to contact HCBD. More information will be forthcoming as we get closer to a full go-live date of January 1st, 2019. The next few slides just provide examples of what Business Solver will look like for employees after January 1st, 2019. The next two slides are an example of how the system will look for a new hire that is newly eligible for benefits. This screen shows the top half of the home page. This screen shows the bottom half of the home page. Members who are already enrolled in benefits can access benefit information in the new system throughout the year. This slide shows where an employee may update their benefit enrollment in the event that they have a beneficiary change or qualify to make a mid-year change such as birth, marriage, or divorce. New hires who wish to elect coverage will continue to use the Sabres enrollment system until December 31st, 2018. However, new hires who complete their new hire enrollment after October 12th, 2018 will be given a special 2-week open enrollment period. HCBD will notify these employees of their special enrollment period and will provide them information on how to complete their elections, including how to access Business Solver. Remember, if they wish to elect or re-elect flexible spending accounts, or the Vision hardware plan for 2019, a new employee must complete an open enrollment election as well. The state plan currently has eligibility rules that are tied to the payroll calendar. With the implementation of Business Solver, it gave HCBD the opportunity to evaluate those eligibility rules and make changes that better reflect the needs of the members and better match how other plans operate. The first eligibility rule or issue addressed was regarding new hires. New hire coverage will still be effective the date of hire if they enroll for coverage during their initial 31-day enrollment period. However, contributions will be collected starting the date of hire versus the first day of the pay period in which they were hired. This will allow members to pay for coverage they actually receive and not for days that they are not enrolled in the coverage. If an employee does not elect coverage during their initial 31-day enrollment period but decides to elect core benefits, medical, dental, and basic life, mid-year, coverage will be effective the first of the month following the date of enrollment. These types of enrollments will now be able to be completed using Business Solver. When an employee experiences a mid-year change, the effective date of the change will now be effective on the date that the change if the employee is enrolling in coverage. For example, if an employee gets married and elects to add coverage for the new dependent spouse, the coverage will be effective on the date of marriage, as long as mid-year enrollment is completed within the 60-day enrollment period. Effective the end of the month following the mid-year change if coverage is being terminated. For example, if an employee gets divorced, coverage for the ex-spouse will be terminated at the end of the month in which the divorce occurred. Mid-year changes will be completed using Business Solver starting January 1st, 2019. When there is an employee death, the employee coverage will terminate on the date of death. Coverage for covered dependents will continue to the end of the month following the date of death. HCBD will receive information about deaths when you update Sabres. You will update Sabres as you do today, and HCBD will be notified of the death. Regarding terminations, this is the biggest change that you will need to become aware of with the new Business Solver system. State plan coverage will now end the last day of the month in which the employee is employed. The termination no longer follows the payroll calendar. Refer to the 2019 Terminating Employee Benefit Coverage Calendar. This calendar is available to take with you today at the presentation, and it was also emailed to the HR payroll group the afternoon of the payroll presentation. It will be posted on the HCBD website as well. This will affect any employee who terminates coverage on or after January 1st, 2019. For example, state plan coverage will terminate January 31st for an employee terminating employment January 15th. In the event that the employee qualifies for a grandfathered month of coverage, the coverage will end the month following the date the employee terminates coverage. For example, state plan coverage would terminate February 28th for an employee who terminates employment on January 15th and qualifies for a grandfathered month of coverage. Contributions for coverage will be collected from the final paycheck. Refer to payroll insurance deduction calendar. Employees will not be able to waive coverage mid-year if the employee is enrolled in the pre-tax plan. Rule changes effective January 1st continue. Business Solver will allow for automated billing. If an employee does not have enough in a paycheck to cover all contributions, nothing will be collected and the employee will be billed. Coverage will be terminated if the employee fails to make payment and they will be provided a 60-day grace period. Contributions will be attempted to be collected on the next pay period if the member is in arrears. HCBD will no longer just reduce coverage and continue to carry account balances from pay period to pay period. If an employee is on leave and does not have enough in a paycheck to cover contributions, they will need to pay attention to the billing they receive and promptly make payment. Business Solver will also be used to handle the following state plan functions. ACA reporting. In 2020, employees will use this system to access the 1095 reporting. Dependent verification and EOI. The system will automate the process for members needing to send in dependent verification documentation, or if they need to complete evidence of insurability. Members will want to pay attention to the reminders they receive from Business Solver. Tax defaults. All spouses will default to pre-tax deductions, and all domestic partners will default to post-tax deductions. Employees will not have the option to change the default. Employees who have made a different election will be changed to the default effective January 1st, 2019. How can HR and payroll staff help? We would appreciate it if you could encourage employees at your agency to participate in one of the 3 webcasts offered, to please encourage managers to give employees time to do so, possibly schedule staff meetings to watch presentations together, which can be a great way to make sure field staff or those who don't work at a computer won't miss out. And posters are still available by emailing HCBD at benefitsquestions@mt.gov to request, or you may go to the website and print them. Please encourage your employees at your agency to participate in one of the 3 webcasts offered. Any questions, please direct them to www.benefits.mt.gov or ask questions using the benefitsquestions@mt.gov email or call us directly. Thank you.